This year, we're also looking forward to including new hospitals that were not with us the first 2 years. So when a new hospital comes on board, they are assigned one of our expert consultants who teaches them about the project, about the events, and gets them set up on our data management system, which is an extraordinary web-based communication portal that we had built specifically for this project. Through weekly coaching calls, the consultant will guide the new hospital's project director and teams at that hospital to select measures on the data management system that they will use to collect data and submit to us on a monthly basis. They will have access to a variety of tools and handouts and recorded webinars that their teams can listen to help them better understand how to improve the care at their hospital. We also invite every hospital to identify a staff person, preferably a frontline staff person, to participate on the monthly event-specific affinity calls. So, for example, every month we hold a group collaborative call with a webinar, so it's interactive through a webinar as well as the phone for every single event. We have one for adverse drug event, one for pressure ulcers, one for surgical site infection, every event, plus a patient and family advisory consult call. So through those collaborative learning calls, through the coaching sessions, through other formal webinars that we hold, the hospitals participating with us have the opportunity to listen and participate in as much as they want and seek the guidance and coaching from their expert JCR consultant.
A lot of the work that we do with our organizations is virtual. When we first put in our proposal to the CMS Innovation Center, it was to have site visits for all of our organizations, and the Innovation Center didn't have the funds that they could approve that. So our work started off completely virtual, and then we identified some areas that the virtual just wasn't helping move the needle. So we looked at our dollars and where we could move them around, and we did put in a few site visits. We probably put in the first year maybe 8 site visits. We also looked at those organizations that were doing early elective deliveries because we knew that was one of the strongest areas that the Innovation Center wanted to address. And so for those organizations that didn't have some of the best practices in place, mostly because of physician resistance, we did do site visits for those too. Going into 2014, we were able to budget for site visits. And so all of the new organizations that we're picking up in 2014, we will definitely be doing 2-day site visits.
I think the keys to success for our hospitals have been activities that have occurred both within the hospital as well as things we, the JCR consultants, have done. Within the hospital, those organizations that have achieved the greatest success have had leadership support. Not just support, but expectations set. They've had physician involvement. They've had well-organized project directors and passionate teams who really believed in the intent to eliminate harm to patients. I think the other side of that has been what we, the JCR consultants, have been able to offer as clinicians, as skilled performance improvement experts, as facilitators on calls where we get hospitals to share with each other. And those strategies all combined with all of our passion for making care safer has led to some phenomenal success.